We ministers were not told about the asymptomatic transmission. This is a really important scientific fact.
Then Health Secretary Matt Hancock, responding to a High Court ruling the government broke the law by discharging untested hospital patients into care homes during the early stages of the pandemic. When the then Prime Minister Boris Johnson was told of the judgment, he responded in the same way.
The thing that we didn't know in particular, Mr. Speaker, was that COVID could be transmitted asymptomatically.
But we know that as early as January 2020, before the UK had confirmed its first cases of COVID, SAGE had warned that there was some evidence of symptom-free transmission. The data, albeit imperfect, continued to mount up through February and March and was acknowledged by leading health authorities.
We ministers were not told about the asymptomatic transmission.
Now listen to England's Chief Medical Officer Chris Whitty answering questions from MPs on 5th of March 2020.
There is a large iceberg of people who've got asymptomatic infection, so a very large number of people have been infected in Hubei without being detected. The reason we don't detect them is we do not currently have a test which can say, a serological test, which can say this person has been infected even though they never had symptoms.
And if only the then Health Secretary had been listening to BBC Radio 4 on March 13th, he would have heard the government's own Chief Scientific Advisor Patrick Vallance say this.
It looks quite likely that there is some degree of asymptomatic transmission.
Johnson himself acknowledged in a press conference on 18th of March the problems the virus posed.
The thing about this disease, it's an invisible enemy, and we don't know who's transmitting it.
So the then Prime Minister clearly knew at that time people without obvious symptoms might be amongst those transmitting the virus. Johnson directly commented on papers examining this issue at a COVID press conference on March 25th.
Just Patrick, on the numbers of people who have the disease asymptomatically, there was a study I saw quoted from some Oxford academics saying that as many as 50% may have had it asymptomatically, or I think a lot of people will have seen that story. How do you evaluate that at this stage?
We simply don't know at the moment, and that's why the antibody test is so important. So there are estimates that up to 80% or more of people in Wuhan weren't detected. There are estimates that of those who are positive, so that's a small percentage of the population who were tested positive, quite a number of them were asymptomatic in a town in Italy.
But it wasn't until 15th of April 2020 the then Health Secretary introduced a policy to test care home patients before discharging them from hospital.
Today we've strengthened the rules so that all care home residents who are discharged from hospital will be tested before being admitted into their care home.
By that time, a staggering 25,000 people had already been discharged from hospital into care homes without being tested for coronavirus. So when the then Health Secretary and then Prime Minister say this,
we ministers were not told about the asymptomatic transmission.
The thing that we didn't know in particular, Mr. Speaker, was that COVID could be transmitted asymptomatically.
They're both talking complete bollocks.
Quite frankly, he either misled the House or was indulging in a barefaced lie.